Hi, my name is Emily Branch, Conversation Health's Head of Community, and today I'm joined by Brendan O'Malley, VP of Sales. He's sharing his take on virtual rep as a former pharmaceutical sales rep himself. Hi, Brendan. Thanks for being here.
Thanks for having me, Emily.
As a former pharmaceutical sales rep, what is your perspective of virtual rep?
Well, as a former sales rep, it's been a number of years, but once you've carried a bag, as they say, you understand that fraternity. And part of that fraternity is, the ability to see physicians, the ability to make an impact. And every day when, you lace them up and you go out to your territory, and your goal is to make an impact and help drive script lift and revenue for your company, help impact patients' lives, and get them on the appropriate therapy. So as you may know, it's very difficult to see physicians. They're not putting out a welcome wagon for drug reps that are out in their territories. Majority of physicians are now no-see, and the ones that will see reps, it's very difficult to get any quality time with them. So where do they get their information from, right? Where do they get on-brand messaging? Where do they find the answers that they need to treat their patients effectively with your brand? That's the virtual rep. When the idea of the virtual rep was introduced to me, I got real excited. It's been years since I carried the bag, but the dynamics of engaging with HCPs remains unchanged. As a matter of fact, it continues to get more difficult for field representatives. And to have a solution like the virtual rep, to have that available for folks in the field is a game changer, I think. So I think it's an exciting platform to help drive revenue and scripts.
What has been the reception of virtual rep by industry?
Not surprisingly, the folks that I have spoken to and engaged with in the industry are excited about the virtual rep. They see it as a game-changing solution that can drive revenue and increase scripts. It's a way to reach more HCPs, both that their field folks can see and those that are no-see. It extends that reach, it extends the frequency, and extends the level of quality engagement. So they're real excited. They lean in. As soon as I begin to tell the story, it's almost a physical thing. They lean in and wait, run that by me again, and you can almost see the light bulbs going off. It's fun.
And why did you join Conversation Health?
I joined Conversation Health for, the reason of something new, something like I alluded to earlier about carrying the bag, knowing that there has to be a better way to reach these physicians. There has to be a better way to make an impact. I've spent a career in healthcare on the pharma side and then on the vendor side. And when it was introduced to me, this category that we're creating, I got excited. I leaned in. My previous job, very reputable company, was glad to be there for as long as I was. We sold solutions that made a difference, but not this type of direct impact. Ultimately close to the ground, impacting the way physicians think, healthcare providers prescribe. So just a really exciting opportunity.
Thank you, and thank you for being here today.
Thanks for having me.